After her symptoms became difficult to manage, our daughter Gabriela decided to take a break from college this semester. She came home to live with me and her dad. She was diagnosed with schizophrenia, and after a couple years of trying different treatments, we settled into a pretty good, stable routine, with Gabriela taking her medication regularly. But Gabriela has a pattern of going off her meds when she feels better. That's when things get worse. Sometimes it feels like we're on a roller coaster. We've been able to manage pretty well by talking with Gabriela's outpatient doctor, adjusting her medication, and encouraging her to continue taking her medication even when she's feeling better. But this time, Gabriela's symptoms grew worse, and we were concerned for her safety. I knew we needed help, so we called the local crisis line. They did an assessment and determined she needed to go to the hospital for inpatient mental health treatment.
I had never been admitted to the hospital for schizophrenia before, so I didn't know what to expect. I was in crisis. My symptoms were pretty bad, and on top of that, I was scared about going to the hospital for the first time.
Schizophrenia is a mental illness that impacts the way a person thinks, feels, and behaves. While people diagnosed with schizophrenia experience the symptoms differently, the typical symptoms include hallucinations, delusions, disorganized thinking and speech, and showing a lack of emotion. The goal of treatment for schizophrenia is to stabilize a person's symptoms throughout their ongoing recovery journey. With medication, therapy, and help from friends and family and community support, many people with schizophrenia can manage their symptoms and work toward their treatment goals. But sometimes a person's symptoms can significantly worsen, and 24-hour medical care is needed to ensure that they are safe. A temporary stay in the hospital, also known as an inpatient treatment, can help to stabilize their symptoms when they have become severe. A person might require temporary hospitalization if they attempt to hurt themselves, display aggressive or threatening behavior toward others, or hear voices that tell them to hurt themselves or others. Sometimes people choose to go to the hospital when they are in crisis. Other times, if a person is a danger to themselves or others and is refusing treatment, they might be admitted involuntarily. The laws about who can initiate and approve involuntary hospitalization vary from state to state, but the important thing to know is that this is a decision that is taken seriously, and it is in place to ensure people in crisis are safe.
After going to the hospital, I realized that an inpatient treatment facility is like a regular hospital, but it's for treating mental illness instead of a medical condition. There are some differences, but basically, the treatment team's job is to help me get the care I need and to get back on track.
Inpatient treatment provides a safe setting that offers many services necessary to help stabilize a person's mental health symptoms. Doctors and other mental health professionals are there to observe symptoms, adjust or change medications, and help educate the patient and their family about symptoms and treatment. There might also be therapists and social workers that provide group, individual, and family therapy. The hospital staff might ask questions about the person's symptom history, what medication has worked and what hasn't. A medical doctor might also check how the person is doing physically. The treatment team works together to find the best treatment options for the person and to discharge them as soon as safely possible. Sometimes, inpatient settings for people in mental health crisis have policies to help people stay safe, like locked unit doors or ensuring that there are no sharp objects around. It's important to remember that people who are admitted to inpatient psychiatric treatment have recently been in crisis and are at various stages of reaching stability. Usually, people participate in inpatient treatment for the shortest amount of time needed to stabilize symptoms following an episode, also known as a return of schizophrenia symptoms. When a person is stable, the treatment team will help with the discharge planning. This is the plan that is put in place with the person's input, so that when they leave the hospital, they have the treatment and community support necessary to maintain recovery in the community. This might include a medication treatment plan, referrals to outpatient care like a psychiatrist they can visit regularly, community mental health support like a case manager, and even housing options.
After a week at the hospital, Gabriela returned home. Her symptoms had improved, and thanks to the treatment team, We learned more about schizophrenia and how to continue working on Gabriella's treatment plan. We were linked with a therapist and a case manager to help Gabriella on her recovery journey.
I'd really like to stay out of the hospital, but I know if I ever need inpatient care again, it's there to help.
Nobody wants to be in crisis. However, if you or a loved one with schizophrenia needs inpatient care, it's helpful to know what to expect and that the inpatient treatment team is there to help you.